So, Mark, very nice guy. Unfortunately, I met Mark in the hospital. He was dealing with a pretty significant infection, and thankfully, with some surgical procedures and some antibiotics and good wound care, we were able to get that resolved. Then he continued to follow me in the office. However, he still was continuing to get quite a bit of pressure under his great toe. And then there was an area on the ball of his foot where we were concerned about ulcers returning and recurring. So that's when we decided to do some minimally invasive surgery to get that resolved once and for all. So not only stop these areas from becoming calluses and wounds, but also to get rid of the pain that he was having. All right, so with Mark, we had to address a couple issues. First of all, we were getting a lot of pressure under this part of the big toe. Um, Two reasons. One, because the joint just didn't bend up very well, and he had a lot of pull from the flexor tendon. So we did a little release to lengthen the flexor tendon to allow that toe to set up. And then I made a little tiny incision here and was able to take a burr about the diameter of like a ballpoint pen and just put that right in here, make a tiny little cut in that bone, and then lift that up. Now we've eliminated the pressure down here completely. So that resolved that issue. The other problem was a lot of pressure underneath this bone called the fourth metatarsal. He was having pain, and we were concerned about an ulcer or wound developing there. So similarly, I made a little tiny incision here and made a tiny cut. Same little burr, was able to make a little cut in that bone to allow that to elevate. Our risks are that we will transfer pressure over to these. So I also made a little cut in each one of these. So now all of these bones can elevate the same amount. Now we've eliminated all the pressure underneath there. So again, minimally invasive surgery, no sutures, no pins, no screws, no hardware, any of that. Just splinting those in the correct position and letting them heal, and he did great.